Question 151. The client has just had surgery to create an ileostomy. The nurse assesses the client in the immediate post-op period for which of the following most frequent complications of this type of surgery? A. Intestinal obstruction. B. Fluid and electrolyte imbalance. C. Malabsorption of fat. D. Folate deficiency. Question 151. Answer: B. Fluid and electrolyte imbalance. Question 151. Explanation: a major complication that occurs most frequent following an ileostomy is fluid and electrolyte imbalance. The client requires constant monitoring of intake and output to prevent this from happening. Losses require replacement by intravenous infusion until the client can tolerate it dietarily. Intestinal obstruction is a less frequent complication. Fat malabsorption and folate deficiency are complications that could occur later in the postoperative period. Question 152. The nurse is doing pre-op teaching with the client who is about to undergo creation of a cock pouch. The nurse interprets that the client has the best understanding of the nature of the surgery if the client makes which of the following statements? A. I will need to drain the pouch regularly with a catheter. B. I will need to wear a drainage bag for the rest of my life. C. The drainage from this type of ostomy will be formed. D. I will be able to pass stool from my rectum eventually. Question 152. Answer: I will need to drain the pouch regularly with a catheter. Question 152. Explanation: a cock pouch is a continent ileostomy. As the ileostomy begins to function, the client drains it every 3 to 4 hours and then decreases the draining to about 3 times a day or as needed when full. The client does not need to wear a drainage bag but should wear an absorbent dressing to absorb mucus drainage from the stoma. Ileostomy drainage is liquid. The client would be able to pass stool only from the rectum if an ileoanal pouch or anastomosis were created. This type of operation is a 2-stage procedure. Question 153. The client with a colostomy has an order for irrigation of the colostomy. The nurse used which solution for irrigation? A. Distilled water. B. Tap water. C. Sterile water. D. Lactated ringers. Question 153. Answer: B. Tap water. Question 153. Explanation: warm tap water or saline solution is used to irrigate a colostomy. If the tap water is not suitable for drinking, then bottled water should be used. Question 154. A nurse is monitoring a client admitted to the hospital with a diagnosis of appendicitis. The client is scheduled for surgery in 2 hours. The client begins to complain of increased abdominal pain and begins to vomit. On assessment, the nurse notes that the abdomen is distended and the bowel sounds are diminished. Which of the following is the most appropriate nursing intervention? A. Administer Dilaudid. B. Notify the physician. C. Call and ask the operating room team to perform the surgery as soon as possible. D. Reposition the client and apply a heating pad on a warm setting to the client's abdomen. Question 154. Answer: B. Notify the physician. Question 154. Explanation: based on the signs and symptoms presented in the question, the nurse should suspect peritonitis and should notify the physician. Administering pain medication is not an appropriate intervention. Heat should never be applied to the abdomen of a client with suspected appendicitis. Scheduling surgical time is not within the scope of nursing practice, although the physician probably would perform the surgery earlier than the pre-scheduled time. Question 155. The client has been admitted with a diagnosis of acute pancreatitis. The nurse would assess this client for pain that is: A. severe and unrelenting, located in the epigastric area and radiating to the back. B. severe and unrelenting, located in the left lower quadrant and radiating to the groin. C. burning and aching, located in the epigastric area and radiating to the umbilicus. D. burning and aching, located in the left lower quadrant and radiating to the hip. Question 155. Answer: a severe and unrelenting, located in the epigastric area and radiating to the back. Question 155. Explanation: The pain associated with acute pancreatitis is often severe and unrelenting, is located in the epigastric region, and radiates to the back. Question 156. The client with Crohn's disease has a nursing diagnosis of acute pain. The nurse would teach the client to avoid which of the following in managing this problem? A. Lying supine with the legs straight. B. Massaging the abdomen. C. Using antispasmodic medication. D. Using relaxation techniques. Question 156. Answer: A. Lying supine with the legs straight. Question 156. Explanation: The pain associated with Crohn's disease is alleviated by the use of analgesics and antispasmodics and also is reduced by having the client practice relaxation techniques, applying local cold or heat to the abdomen, massaging the abdomen, and lying with the legs flexed. Lying with the legs extended is not useful because it increases the muscle tension in the abdomen, which could aggravate the inflamed intestinal tissues as the abdominal muscles are stretched. Question 157. A client with ulcerative colitis has an order to begin salicylate medication to reduce inflammation. The nurse instructs the client to take the medication. A. 30 minutes before meals. B. On an empty stomach. C. After meals. D. On arising. Question 157. Answer: C. After meals. Question 157. Explanation: Salicylate compounds act by inhibiting prostaglandin synthesis and reducing inflammation. The nurse teaches the client to take the medication with a full glass of water and to increase fluid intake throughout the day. This medication needs to be taken after meals to reduce GI irritation. Question 158. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client is also complaining of pain near the area of the ear. The client has been NPO for several days because of the insertion of a Eng tube. Based on these findings, the nurse suspects that the client is developing which of the following mouth conditions? A. Stomatitis. B. Oral candidiasis. C. Parotitis. D. Gingivitis. Question 158. Answer: C. Parotitis. Question 158. Explanation: The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client should lead the nurse to suspect the development of parotitis, or inflammation of the parotid gland. Parotitis usually develops in cases of dehydration combined with poor oral hygiene or when clients have been NPO for an extended period. Preventative measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. Stomatitis, inflammation of the mouth, produces excessive salivation and a sore mouth. Question 159. The nurse evaluates the client's stoma during the initial post-op period. Which of the following observations should be reported immediately to the physician? A. The stoma is slightly edematous. B. The stoma is dark red to purple. C. The stoma is a small amount of blood. D. The stoma does not expel stool. Question 159. Answer: B. The stoma is dark red to purple. Question 159. Explanation: A dark red to purple stoma indicates inadequate blood supply. Mild edema and slight oozing of blood are normal in the early post-op period. The colostomy would typically not begin functioning until 2-4 days after surgery. Question 160. When planning care for a client with ulcerative colitis who is experiencing symptoms, which client care activities can the nurse appropriately delegate to an unlicensed assistant? Select all that apply. A. Assessing the client's bowel sounds. B. Providing skin care following bowel movements. C. Evaluating the client's response to antidiarrheal or EL medications. D. Maintaining intake and output records. E. Obtaining the client's weight. Question 160. Answer: B. Providing skin care following bowel movements. D. Maintaining intake and output records. E. Obtaining the client's weight. Question 160. Explanation: The nurse can delegate the following basic care activities to the unlicensed assistant: providing skin care following bowel movements, maintaining intake and output records, and obtaining the client's weight. Assessing the client's bowel sounds and evaluating the client's response to medication are registered nurse activities that cannot be delegated.